Hi everybody, Dr. Manny here. Welcome to Dr. Manny's YouTube Learn Shops. This is the last part or the last Learn Shop for Pharmacology for Nurses, Part 8, Gastro-Intestinal and Endocrine Medications. The learning objectives for this session will basically be to review gastrointestinal physiology, endocrine system physiology, look at some of the selected GI medications, gastrointestinal medications, endocrine medications, and then at the end of the Learn Shop, see what you've remembered. Now, remember the gastrointestinal system comprises of the mouth, pharynx, esophagus, stomach, small and large intestine, the rectum and the anus. It also includes salivary glands, the liver, the gallbladder, and the pancreas. Now, the stomach is important. It's a muscular organ located on the left side of the upper abdomen. It receives food from the esophagus. The stomach has muscles that contract periodically. They churn food, mechanical digestion, to enhance digestion. The pyloric sphincter is the muscular valve that opens to allow food to pass from the stomach to the small intestine. It's important to remember the stomach has got mucus cells which secrete mucus. It has chief cells which secrete pepsinogen, and it has parietal cells which secrete hydrochloric acid. The intestines, what are they? They're long. They're a continuous tube running from the stomach to the anus. Most absorption of nutrients and water happens in the intestines. Mostly in the small intestine. The large intestine typically is just water. The intestines include the small, large, and rectum. Small intestine, the large intestine called the colon, and the exit point is the rectum and anus. Smooth tissue lines the small intestine, which is divided into the duodenum, jejunum, and ileum. The liver is the largest solid organ in the body. It removes toxins from the body's blood supply, maintains healthy blood sugar levels, regulates blood clotting, and performs hundreds of other vital functions. The gallbladder, which you can see, is on the right side of the abdomen, just beneath the right lobe of the liver. It's important to remember that the liver generates bile. Bile is stored in the gallbladder. Bile is secreted into the small intestine, as are pancreatic juices to aid with digestion. The pancreas is an organ that has got both endocrine functions because it releases hormones, juices, directly into the bloodstream. And it's got exocrine functions because it releases digestive juices directly into ducts. Enzymes, hormones, or digestive juices are secreted by the pancreas into the small intestine. It consists of a head, neck, body, and tail. Now, it's important to remember the endocrine component that we're concerned about today are to do with the islets of Langerhans, which regulate blood sugar, release insulin, glucagon, and somatostatin. The exocrine component have got acini, or small glands, and they release protease, lipase, and amylase for the digestion of food. The first group of medications that we're going to look at are antiemetics. And antiemetics, emetic, vomit, anti, don't vomit, prevent or terminate nausea and vomiting. And these are drugs that are effective against vomiting and nausea, and typically they're used to treat motion sickness and the side effects of opiate analgesics or general anesthetics, or chemotherapy directed against cancer. There is a vomiting centre, which is one of the higher centres located close to the brainstem. The first medication that we're going to look at is called prochlorperazine, Stemetil. It's an antiemetic. It's indicated for nausea, vomiting, and certain psychiatric conditions. Major adverse effects are sedation, muscle spasm, orthostatic hypotension. The adult dose is typically around about 5 to 10 milligrams, QID or PRN. It can be given intravenously, intramuscularly, or orally, and even as a suppository. Pediatric, the routes are basically the same, however the dose is about 2.5 milligrams TID, but this will depend on your organisational policy. Then you've got ondansetron, Zofran, and this is a 5-HT serotonin blocker antiemetic. Indications again for nausea and vomiting. Adverse effects include sedation, fatigue, diarrhea, headache, and general malaise. Adult dose is typically 4 milligrams intravenously or intramuscularly. And in pediatrics, it depends on their size because it's given according to weight. If they're more than 40 kilograms, 4 milligrams per dose. Less than 40 kilograms, 0.1 milligram per kg. Then you've got Maxilon, metoclopramide. This is a dopamine blocker that increases ACH effectiveness. It increases bowel motility in the upper GI tract and therefore causes an increase in peristalsis and may eliminate nausea and vomiting. It relaxes the pyloric sphincter. It's an antiemetic in this instance. Indications are for nausea and vomiting. Major adverse effects include restlessness, diarrhea, dizziness, and fatigue. Adult dose is typically 10 to 20 milligrams per dose. Pediatric, 0.1 milligram per kg per dose. It can be given intravenously or intramuscularly. Then we have the group of medications called histamine antagonists. They block H2 receptors. And H2 receptors essentially are related to parietal cells that produce hydrochloric acid. And if they block, they don't produce hydrochloric acid, hydrogen ion, or chloride. In this instance, they don't affect the proton pump. We have other medications that do that, which we'll be reviewing. So, if we have an ulcer, or the potential for an ulcer, whether it's duodenal or gastric, in the mucosa, submucosa, or muscle, then a H2 receptor blocker may be recommended. Histamine antagonists. The one that we're going to look at, or one of the ones we're going to look at today, are cimetidine, which is Tagamet. And the action of cimetidine is to competitively block histamine. And therefore, it reduces gastric acid secretion by about 50 to 80%. What is it indicated for? Prophylaxis in critically ill patients because they're stressed. And typically they may not be eating. Gastric or duodenal ulcers, Helicobacter pylori, which causes peptic ulcers, gastric hyperacidity states, Zollinger-Ellison syndrome. The major effects of this medication are headache, dizziness, diarrhea, and gynecomastia. The adult dose is typically 300 milligrams. Pediatric dose 25 to 50 milligrams per kg daily. It can be given orally, intravenously, or per rectum. Then you've got ranitidine or Zantac. And this is a competitive histamine receptor blocker as well. And by the same token reduces gastric acid secretion by 50 to 80% and is indicated in all the same instances as was cimetidine. The major adverse effects are headache, abdominal pain, diarrhea, and constipation. And the adult dose, IV or orally, 150 milligrams per dose. pediatric IV orally 5 to 10 milligrams per kg per dose. Maximum is 150 milligrams as per the adults. Then you've got proton pump inhibitors, and it's an inhibitor of the parietal cell hydrogen ion, potassium ion, and ATPase. It decreases gastric acid production, essentially. And proton pump inhibitors work at the connection between the stomach and the parietal cells, where hydrochloric acid is produced. As you can see in the diagram, the parietal cell is blocked, the proton pump is blocked, and medications such as omeprazole and esomeprazole block the proton pump here. The proton pump inhibitors, they affect the parietal cell and therefore decrease gastric acid production, essentially resting the stomach. Now, esomeprazole suppresses the final step in gastric acid production. It inhibits hydrogen ion, potassium ion, and ATPase in gastric parietal cells. Why is it given? Same reason as the others: prophylaxis in critically ill patients, gastric duodenal ulcers, Helicobacter pylori that create peptic ulcers, gastric hyperacidity states, and Zollinger-Ellison syndrome. Adverse effects are fairly generic: headache, abdominal pain, diarrhea, and constipation. Adult dose, intravenously or orally, 20 to 40 milligrams per dose, BID. Pediatric, intravenously or orally, 10 to 20 milligrams daily. Omeprazole, Prilosec, is similar to omeprazole. It's prophylaxis for critically ill gastric duodenal ulcers, Helicobacter pylori peptic ulcers, gastric hyperacidity states, and Zollinger-Ellison syndrome. Dose in an adult typically 20 to 60 milligrams daily, intravenously or orally. Pediatric 10 to 20 milligrams daily by the same routes. Now, we're just going to cover some of these as miscellaneous categories as far as anti-ulcer medications go, but according to the evidence-based practice and research, they're not that effective. So you have sucralfate, and essentially the action of this medication is to form ulcer adherent complex with albumin and fibrinogen, and possibly it increases gastric mucus production to prevent further gastric acid trauma. Indications are stomatitis, prophylaxis in critically ill patients, gastric or duodenal ulcers. Adult dose is typically 1 gram QID or BID, pediatric 40 to 80 milligrams daily, orally. In the critically ill patients, it's probably given down a nasogastric tube or an enteral feeding tube. Major adverse effects: back pain, constipation, nausea, and dizziness. Then you've got aperients, stool softeners, such as docosate. And what it does is reduce fecal surface tension, allowing water, fats, to penetrate and increase softness of the stool. Indications? Well, when you're straining. And you don't want to be straining when you've got cardiovascular disease or you've got a hernia. Indications are if you're bedridden, if you've got megacolon, or you're constipated. Adult dose is typically orally 240 milligrams daily till you've got a bowel motion, and in pediatrics 50 to 150 milligrams daily till there's a bowel motion. Adverse effects include nausea, abdominal cramps, flatulence, and diarrhea. Let's review hypoglycemic agents. Now, we've got two types of diabetes essentially, type 1 and type 2. Sure, we've got adult maturity onset. Sure, we've got juvenile. However, we'll just look at it as type 1 and type 2. Type 2 diabetes, essentially, you're not producing enough insulin. And if you're not producing enough insulin, then glucose can't be actively transported across the cell membrane via the insulin receptor. Now, the medications that increase peripheral absorption and utilization of glucose, the first one is metformin. And it decreases hepatic glucose production, it decreases intestinal glucose absorption, and does not increase insulin secretion. It remains the same. Metformin is used typically for diabetes type 2, diabetes mellitus. Major adverse effects: hypoglycemia, headache, nausea, abdominal pain. The adult dose orally is typically 500 to 2,500 milligrams BID, always taken with meals. Then you've got glibenclamide, Dianol. And the action isn't really that well known, but it's thought to increase insulin secretion from the functioning pancreatic beta cells. There's a decrease in insulin resistance as well from the tissues. Again, the indication, type 2 diabetes mellitus. Adverse effects: hypoglycemia, headache, nausea, abdominal pain. The adult oral dose is 1.25 milligrams to 20 milligrams daily, taken with the first main meal. Now, hypoglycemic agents that are type 1 diabetes, this means you're not producing insulin. So therefore, it has to be replaced in totality. Insulin has got many subcategories. The first one is insulin aspart. This is a rapid acting and is similar to human insulin. And it has to be given in combination with a long-acting insulin because it's short. Its peak is in 1 to 3 hours. Duration is only for about 3 to 5 hours. Onset in 15 minutes. Adult dose is typically 0.5 to 1 unit per kg per day with meals. However, a physician will be ordering it, possibly in relation to a sliding scale insulin or according to his or her assessment. Indications are type 1 diabetes mellitus, adverse effects: hypoglycemia, hypokalemia, even a site reaction because it has to be given subcutaneously. Then you've got insulin detamir. This is an intermediate, long-acting over 24 hours. It binds to tissue insulin receptors, facilitates uptake of glucose into skeletal and adipose cells, and it inhibits hepatic glucose synthesis. And it is ordered according to the blood glucose level. A typical dose is given once or twice daily, and the indications are in adults type 1 and type 2 diabetes mellitus, in pediatrics type 1 diabetes mellitus. Adverse effects are the same as previously: hypoglycemia, hypokalemia, lipodystrophy, and site reaction. Insulin glargine. This is a long-acting recombinant human insulin, and it binds to tissue insulin receptors, and it's ordered according to blood glucose level. A typical dose is about 10 units once daily. Onset 1 hour, duration 24 hours. In adults, type 1 and type 2 diabetes mellitus is the indication, pediatrics type 1. Side effects are basically the same. When we look at regular insulin, Humulin R, this is a short-acting recombinant human insulin, which means it's generated in the laboratory. It's given in combination with more long-acting insulins, and it's according to the blood glucose level. Typically 5 to 10 units. If you give an infusion, 0.1 units per kg per hour, and pediatrics initially 2 to 4 units. And the indications are diabetes type 1 in pediatrics, or diabetic ketoacidosis coma in emergencies. That's what the infusion is used for. Adverse effects: hypoglycemia, hyperkalemia, lipodystrophy, and site reactions. You've got insulin zinc, lente. This is an intermediate acting insulin, and it's 70% crystalline, 30% amorphous type of insulin. Ordered according to blood glucose levels. Indications: diabetes mellitus type 1, insulin allergies, not suitable for emergencies, not a replacement for regular insulin. Adult dose is initially 7 to 26 units over 30 to 60 minutes before breakfast. Then you've got concentrated insulin, which I think will be the last one that we'll be discussing. This is Humulin, recombinant, regular U500. And this is a long-acting recombinant human insulin. It binds to the tissue insulin receptors. It's concentrated. According to blood glucose levels is how it's ordered. Subcutaneous only 1 to 3 times daily, duration 24 hours. Adults, type 2 diabetes mellitus, or those with insulin resistance requiring more than 200 units per day. Adverse effects: hypoglycemia, hyperkalemia, lipodystrophy, and site reactions. Now let's review. Can you name 2 antiemetic medications? I can. They are ondansetron and metoclopramide, but we mentioned others as well. Can you name 2 histamine 2 antagonists? I can. They are ranitidine and cimetidine, which were the only 2 that we discussed. Can you name the 5 medication rights? And I've included this here again in the first Learn shop for pharmacology for nurses, and in the last, since we won't be discussing it again. But you need to remember this. I've included the 5, but remember, depending on which organisation you work for, you can have up to 18 medication administration rights. From my perspective, the more confusing. The first one is right patient, full name and medical record number. Second one, right prescribed medication, generic name preferable, written clearly and correctly by the physician or the ordering person. Third right transcribed medication dose, no abbreviations, written clearly and correctly. Fourth right prescribed medication route, no abbreviations, written clearly and correctly. Fifth, right prescribed medication date and time, no abbreviations, written clearly and correctly by the prescriber. Review activity 4. Name 2 proton pump inhibitor medications. They are esomeprazole and omeprazole. Name 2 oral hypoglycemic medications. They are metformin and glibenclamide. Can you name 3 potential adverse effects associated with insulin medications? Hypoglycemic diabetic coma, altered tissue perfusion, and anaphylactic shock. Thanks again. That's the end of Pharmacology for Nurses Learn Shops 1 to 8. Thanks for checking out Dr. Manny Learn Shops on YouTube. If you found these of any benefit, please recommend them to your colleagues. Subscribe. Ask if there's anything extra that you think could be included. And I'll see you in other Dr. Manny Learn Shops on YouTube. Bye for now.